Okay, let's unpack this. We all know sleep is important, right? But maybe not how important. I mean, it's not just downtime. Your brain's actually working hard, forming pathways. Alan Rechtschaffen, the sleep expert, he basically said if sleep isn't vital, it's evolution's biggest blunder. Yet look around. So many people, maybe a third of adults, just aren't getting enough. And in the U.S. alone, 50 to 70 million people have chronic sleep issues, it feels like.
Well,
Like we often value being busy over being rested.
yeah, it's become almost cultural in some places, which really brings up a key question. We know lack of sleep links to heart disease, cognitive problems, mental health issues. Shouldn't sleep health be right up there with diet and exercise and public health? Like a cornerstone.
Exactly.
So that's our mission today, isn't it? To really dig into how poor sleep messes with your mental state, short-term, long-term, right down to brain chemistry, and importantly, what you can actually do about it.
Right. So let's start with the immediate stuff. That feeling after just one bad night, is it just being grumpy or is there more going on?
Oh, it's definitely more than just grumpy. Studies clearly show it's not just an uptick in negative feelings like anger or sadness. It actually dials down your ability to feel positive emotions too. You know, that feeling of excitement or joy, it gets blunted.
Huh, interesting.
Remember that University of Pennsylvania study? They limited people to like 4.5 hours of sleep.
Yeah, I remember reading about that.
They felt way more stressed, angry, exhausted. But the moment they got back to normal sleep, big improvement in mood.
So that time you snap over something tiny after a bad night, that's not just you being overly sensitive.
Exactly. It's your brain literally struggling to regulate those emotional responses. It's physiological. And, well, think about the ripple effects.
Right.
If you're often irritable or, emotionally volatile, that impacts your relationships, family, friends, work.
And for kids and teens, I imagine it looks different.
Yeah, it can manifest as things that look like ADHD, sometimes hyperactivity, trouble focusing, maybe acting out, big mood swings.
Okay, so that's one night. What about when it becomes the norm? When sleepless nights are just life? People say they get used to it.
That's a dangerous idea, getting used to it. Because chronic sleep deprivation doesn't just sap your energy, it actively erodes your psychological resilience. It makes you much more vulnerable to developing serious mental health conditions.
Ah, so it's that vicious cycle I've heard about.
Precisely. It's profoundly bidirectional. Poor sleep makes anxiety or depression worse, and then the anxiety and stress make it harder to quiet your mind to fall asleep. It just feeds itself.
It sounds like a trap.
It really can be. And here's something quite striking. Some research suggests sleep disturbance might be the strongest predictor of developing psychopathology later on.
Wow. More than things like difficult childhoods or family history.
Potentially, yes. It highlights just how fundamental sleep is.
Okay, so mood and mental health resilience take a hit. What about just thinking? That brain fog people talk about, is that real?
Oh, absolutely real. Poor sleep significantly messes with concentration. Decision-making gets worse. Problem-solving skills tank.
Like being drunk, almost.
Some studies have actually made that comparison, yeah. The level of cognitive impairment can be similar after significant sleep deprivation.
And long-term.
Long-term, the links are worrying. Increased risk of neurodegenerative diseases, things like Alzheimer's and dementia.
So how does that work? What's happening, like, inside the brain?
Okay, so think about key brain areas. Your prefrontal cortex, that's for planning, decisions, impulse control, activity changes, it gets impaired.
Right.
Your amygdala, the emotion center, especially for negative stuff, it becomes hyperreactive. So you react more strongly to negative things.
Okay, that explains the irritability.
Exactly. And the hippocampus, crucial for forming new memories, that gets hampered too.
Some memory problems as well.
Definitely. And it goes deeper. It affects neurotransmitters, chemicals like serotonin and dopamine that regulate mood. Plus, sleep is when your brain does its housekeeping.
That's heaping.
Yeah, literally clearing out metabolic waste products that build up while you're awake. Things like beta amyloid proteins.
Which are linked to Alzheimer's.
Precisely. So if you're not sleeping enough, your brain isn't cleaning itself effectively. It's not just passive tiredness. It's like an active failure of the brain's maintenance system.
Wow. Okay. That paints a pretty stark picture. So, the crucial question, how do we break this cycle? How do we fix it?
Well, the foundation is good sleep hygiene. It sounds basic, but it's powerful. Consistent sleep schedule, even on weekends, dark, quiet, cool bedroom. Avoiding screens before bed is a big one. Having a wind-down routine.
The basics. But what if that's not enough? If the problem's really persistent?
And then professional help can make a huge difference. And one of the most effective non-drug treatments is cognitive behavioral therapy for insomnia, or CBTI.
CBTI. How does that work?
It's a structured program. It helps you identify and change the thoughts and behaviors that are actively interfering with your sleep. It basically retrains your brain for better sleep.
And it helps with just sleep, or...
That's the fascinating part. It doesn't just improve sleep. Studies show it significantly improves overall mental health, too. Reduces symptoms of anxiety, depression, even PTSD. It really leverages that deep connection we've been talking about.
So it tackles both sides of that vicious cycle.
Exactly. It's a really powerful tool.
It's clear, then, sleep isn't some kind of optional luxury. It's fundamental.
Yeah.
A critical investment in your mental health, your ability to think, your entire quality of life.
Absolutely. And if we all start recognizing sleep as this core pillar of well-being, right alongside diet and exercise, it empowers us. It empowers us to build strategies, personally and maybe even societally, for a healthier, more resilient population, for a healthier you.
Makes you think, doesn't it?
Yeah.
So listening to this now, maybe consider what's one small step you could take, maybe even starting tonight, to invest in your own mental resilience through better sleep.